Testimony on Bill number 180457. I want to recognize the presence of a quorum of committee members. Members in attendance are Councilman Curtis Jones Jr., Councilman Bill Greenlee, and Councilman Derek Green. And the clerk will now read the title of Bill number 180457.
Bill number 180457, an ordinance amending Chapter 9-600 of the Philadelphia Code entitled Service and Other Businesses to add a new section 9-637 entitled Sale of Flavored Tobacco Products, prohibiting offering for sale and selling certain tobacco products other than cigarettes with characterizing flavors and fixing penalties, all under certain terms and conditions.
Thank you very much. And if we can have the first panel come forward to testify, if the clerk can name the first panel that's going to come forward.
Dr. Thomas Farley, Health Commissioner, Philadelphia; Tanetta Graham, Strawberry Mansion CDC; and Carol Parkinson Hall, Alpha Kappa Alpha Sorority.
No, we're fine. We're fine. I want to get us out of here. See all them people? Okay. I'm good. Okay. If you want, all right, we can do it. I'll do it.
And while they're coming forward, we're going to hear from Councilman Curtis Jones Jr., who has opening remarks. Councilman?
Thank you, Madam Chair, and thank you all for coming here today. It's a little overwhelming to see this many people about this important issue. I want to tell a little story about my childhood before we start, and I promise I won't take too long. I think that's a promise. So I remember my mom and my dad sending me to the corner store. I've told this, doctors heard this story before. And she would send me with $5 in order to get a pack of cigarettes for her, and it was Virginia Slims, and my father smoked Pall Malls. They would also treat themselves to a soda, Dr. Pepper, and a Pepsi. And I would wind up with a little bit of change back in my pocket. That's why I was looking forward to going to the store. So the cost of the actual cigarettes and sodas was less than $5. I had no idea that the cost of those cigarettes and that soda was far, far more. It would mean the cost of my mother and my father's life. My father died of lung cancer, probably associated with those cigarettes. And my mother passed away, and my brother and I were, during a storm, bringing her medicine to the house. I was on a radio interview in the car. My brother went up to drop off the medicine and waved me in, told me come on in. And what I remembered, my mother was in a stroke state, but what I remembered most was there was a lit cigarette in the ashtray when we approached. So today's hearing is important. It's important not because we're talking about menthol cigarettes, maybe we should be, but we're not. But when you cross the line of marketing flavored tobacco and marketing it and packaging it like kids' candy, you have crossed the line for me and many others. So what we are calling for is a ban of flavored tobacco in the city of Philadelphia. We talked about this, and I did this in a speech of the majority, bored my colleagues once again, to talk about why stores had placed these products so closely together. And if you look at this, several people have come up since I put it out there thinking it was a free candy giveaway and mistakenly picked up flavored tobacco because of the color combinations that are targeted towards our young people. We talked about it a year ago. I took pictures, which I will give out today, that at a store at 60th and Media, we took a picture through the window of how close these products were together. And it is sinful in the marketing to try to subliminally get kids interested in and then addicted to tobacco products. In that same store, I could not find a vegetable. In that same store, I could not find a healthy meal for my grandkid on her way to school. But I could find flavored tobacco and candy closely associated product-wise one to the other. So today I want to hear testimony, and I want us to look at this action. We're not going to go quickly through it. We will take our time for final vote, but I hope, Madam Chair and members of this committee, that we will finally take an action to separate good health from improper habits in the city of Philadelphia. Thank you.
Thank you, Councilman. And, you know, I want to say, you know, that story resonates with me because I remember, you know, going to our neighborhood store and picking up cigarettes and, you know, items for my mother, who I lost to cancer as well. And so it resonates. And I'm not the only one. You're not the only one. These stories are too far in abundance, particularly in vulnerable communities. So, and with that being said, why don't we start our testimony. Commissioner, if you want to begin. State your name for the record and please begin.
Good morning, Chairwoman Bass and members of the Public Health and Human Services Committee. I'm Dr. Thomas Farley, Health Commissioner for the City of Philadelphia. Thank you for allowing me to give testimony in Bill number 180457, which, if enacted, would ban sales of fruit and candy-flavored cigars and cigarillos in the city. Now, there are proposed amendments to clarify the products, excuse me, that the bill would include, and I am in agreement with the proposed language. Thanks to Councilman Jones for sponsoring this bill, and I'd like to thank the many council members who co-sponsored the bill. Everyone knows that smoking is bad for their health, but few people recognize just how bad it is for us individually or for the city as a whole. Tobacco is the top preventable cause of death in Philadelphia, causing thousands of deaths each year. Chronic lung disease due to smoking and secondhand smoke exposure causes thousands of the city to suffer for years as they struggle to breathe through diseased airways, limiting their ability to work and diminishing their quality of life. Tobacco use increases the risk of prematurity, sudden infant death, and childhood asthma for infants and children exposed to secondhand smoke. Everyone in this room knows someone who has died from smoking. We shouldn't accept that as normal, though. Nearly 90% of smokers start before the age of 18, so preventing youth smoking is critical if we want to change the future of health in Philadelphia. We have made great strides in the past few years against youth smoking of conventional cigarettes, reaching a low of 7.1% of teens in the latest analysis. This council has done its part in the battle, passing a tax on cigarettes that helps fight tobacco addiction while raising money for the city's schools. But those gains are being undermined by the proliferation of dirt-cheap little cigars and cigarillos in flavors literally right out of the candy shop. These products, sold 4 or 5 for 99 cents and wrapped in bright colors with pictures of ice cream cones and brownies in the front, help fuel a huge increase in cigar smoking among our youth. Here's some of them right here. This is, by the way, fruit punch flavored. Then we've got tropical tango, and then we got French vanilla. From 2011 to 2015, cigar use among Philadelphia's teens increased from 6% to 10.5% in just 4 years. And among black teens, it nearly tripled, rising from 4.5% to 11.9%. Substantially more teens in Philadelphia now smoke cigars than cigarettes. These cigars aren't subject to city, state, or federal cigarette taxes or to FDA restrictions that ban flavorings other than menthol in cigarettes. When my staff show these products to young children, they think they are candy. Many kids tell us they think the products must be safer than cigarettes because they are clearly marketed to kids. But each cigarillo contains the same amount of tobacco as 3 cigarettes. So for 99 cents will buy you the addictive equivalent of 3/4 of a pack of Newports. It's not legal for stores to sell these products to teens, but many store owners do not abide by that law. There's a typo in the written testimony. Many store owners do not abide by that law. Here in Philadelphia and across the state, sales of tobacco to youth are on the rise, increasing from 12% in the fourth quarter of fiscal year 17 to 35% in the most recent quarter here in Philadelphia, despite the fact that we have increased the number of youth compliance checks to stem that tide. Let me explain what I mean by that percentage. we send youth that are underage into stores to attempt to buy tobacco products. And 35% of the time now, they are sold as products by the people working in the store. And even if the store owners complied with the law 100% of the time, we know that kids would continue to be able to get tobacco from their friends who are over 18. Now, I have no doubt that the tobacco industry will have recruited store owners to tell you today that they cannot afford not to sell these products. But the cost of tobacco goes far beyond the deaths it causes. Smokers spend thousands of dollars per year on tobacco products, which have a very narrow profit margin, so that almost all those dollars leave the city. Smokers also make less than non-smokers, on average about 20% less. As the city's health commissioner and witness to the cost of these products on our lowest income residents, I need to tell you that we cannot afford the cost of addicting another generation to tobacco. This bill is one step to help protect that generation. Thank you for the opportunity to offer testimony on this bill, and I'd be happy to answer any of your questions.
Thank you, and we're going to hold questions until the end of the panel. Next witness, state your name for the record and begin your testimony.
Hi, I'm Amaya Toby. I go to Master Charter Shoemaker campus. I was part of Raise Woke. We've been here before to talk with you guys.
Speak into the mic, I'm sorry.
Sorry.
That's all right.
I'm a junior, and I'm basically here to testify against this.
Okay.
I live in West Philadelphia under Councilwoman Janie Blackwell's district, where tobacco is around almost every corner. I'm aware of the easy access to tobacco that draws in youth, especially in the many flavors it comes in. They can come in as cherry, vanilla, fruit punch, grape, cotton candy, and etc. with bright colors, wrapping and simulating candy. Amazingly, the access to such sweet harm is only a couple steps away from youth. For example, I had an old friend named Curtis. He used to go to school with me until dealing with unfortunate situations. Now he spends most of his days on a corner near my school smoking what most people call blacks and fruit punch / grape flavored tobacco, which he says is his favorite. It can truly be said that Curtis' story isn't as rare from what we observe in our communities today. There are plenty of youth on the same corners and even more plotting on their next fix of tobacco. Sadly, we don't question enough why it even exists in our poor neighborhoods. I grew up in both the suburban and urban communities and seen that those in the suburban communities weren't really around tobacco ads and reminders low enough for children to get a little inspiration like how it is in the urban communities. I'm also sure that Curtis didn't figure out tobacco on his own. From rappers like Cardi B back to Lil Wayne, higher star influencers, give their fans the message that smoking tobacco is a cool thing to do, thus leading youth, like my friend Curtis, down a road towards not just the corner of constant smoke breaks, but an addiction, cancer, and regret of ever latching on. Obviously, as a part of the current youth, I'm irritated at the fact that most of us are already dying of disease due to a flavored cancer stick. I'm upset that the access to die is so easy in a poor neighborhood, and I am furious that I have to defend the lives of youth who don't deserve the news that their health is failing and that they have to communicate through a hole in their neck. Those in charge of selling / making these flavored products are targeting youth who are my friends. When saying this out loud or even reading it, it is the most sickening thing I've ever heard or had to say as a young person myself. I can understand that business goals would be to flourish, but it shouldn't flourish by taking lives. What I am surely confused on is why this operation even exists, and even better, why are we talking about this operation in the first place when we know who it's affecting at the end of the day? We're asking you to ban these flavored products because it's harming not just us, but our futures. In his hopes, I hope that you truly agree. Chris.
Thank you for your testimony. Okay, please state your name for the record and begin.
Carol Parkinson Hall. Good afternoon, Chairwoman Cindy Bass and members of the Department of Public Health and Human Services Committee. As I said before, I'm Carol Parkinson Hall, a resident of Philadelphia, Council District 9. I come before you today as a member of Alpha Kappa Alpha Sorority Incorporated Omega Omega Chapter to support Bill number 18057, which is sponsored by Councilman Curtis Jones. I serve as the president of the chapter and a member of the Connection Committee. The Connection Committee is the Advocacy, Social Justice, and Civic Engagement Committee of the sorority. We serve on a nonpartisan basis to conduct voter registration drives, advocate for education equity, health care reform, and other legislative initiatives, just to name a few. We empower citizens as stakeholders to be a part of and not apart from the solutions to problems that plague our communities. Alpha Kappa Alpha is an international service organization founded on the campus of Howard University in Washington, D.C. in 1908. It is the oldest Greek letter organization established by African-American college-educated women, one generation removed from slavery. We are comprised of nearly 300,000 members and over 1,000 chapters globally. Alpha Kappa Alpha's mission is to cultivate and encourage high scholastic and ethical standards, to promote unity and friendship among college women, to study and help alleviate problems concerning girls and women in order to improve their social stature, to maintain a progressive interest in college life, and to be of service to all mankind. Omega Omega Chapter, the home of the late Augusta Clark and Dr. Ruth Wright Hare, has been dedicated to serving the greater Philadelphia area since its chartering in 1926. It is in this spirit of our unwavering commitment to the uplift of our people to ensure a more humane Philadelphia that we present this testimony this afternoon. In 2015, Philadelphia became the first city in the United States of America to gain the distinct honor of being named a World Heritage City. We boast with pride about our national treasures, our historic landmarks, and our diverse cultural institutions. But neighborhoods where underprivileged African American and Latino youth reside. Hood wraps are more readily available than school supplies. So good, so hood. So hood, so good. That's the slogan associated with the flavored cigarillos that are aggressively marketed to our youth. Nelson Mandela once said, "There can be no keener revelation in a society's soul than the way in which it treats its children." We all know the dangers of smoking. Smoking is the leading cause of preventable deaths in the United States, such as cancer, heart disease, lung disease. Research even shows how secondhand smoke impacts our health negatively. Many studies show how young smokers are more likely to experiment with marijuana, cocaine, heroin, and other drugs. The sale of flavored tobacco products to our children at corner stores must end. Alpha Kappa Alpha Sorority Incorporated, Omega Omega Chapter, stands ready to work with the members of City Council and other stakeholders to stop the sale of flavored tobacco products like cigarillos to our children. While we support this legislation, we think that it's terribly important that we not forget the role that mentholated tobacco products plays in killing African Americans and Latino women and children. Predatory marketing strategies are used to target these populations, and I sadly must say that these are the people who too often lose out in the horse trading between commerce and politics, or politricks. We support the city's Department of Public Health and Bill number 180457. We strongly appeal to the members of City Council to pass this legislation. Thank you for the opportunity to testify today. In service, the members of Alpha Kappa Alpha Sorority Incorporated, Omega Omega Chapter, Carol Parkinson Hall, President.
Thank you all very much for your testimony, and you know, it was very heartfelt and you know, just really informative, and I think that everyone here really does appreciate it, appreciate your expertise and all that you have done to really protect our young people, most importantly. So I just wanted to thank you all for being here. Councilman Jones?
I'm going to hold comments, which is not traditional for me, the chair will tell you,
Yes.
because I always have something to say, but I want to give everyone else an opportunity to speak, and we have another hearing
Yes.
to do a budget after this, so I'm going to withhold my comments, but thank you, sincerely.
And we thank you for holding your comments, Council. Thank you so much for being here. If we can have the clerk call the next panel forward to testify.
Dr. Brian Jensen, American Academy of Pediatrics, Children's Hospital Philadelphia Policy Lab. James Redrick Kingrow. And also Tanetta Graham, Strawberry Mansion CDC.
Thank you. Please state your name for the record and begin your testimony.
James Redrick, King Grill.
Pull it a little closer. Just pull the whole mic.
Yeah.
There you go.
Death is inevitable. That's for certain. We do know that in life. I mean, you can't avoid it. But we are happy to say that King Grill took on a responsibility to no longer offer tobacco products to our customers. Our civic duty as a caring champion to the community is to offer a healthy, affordable product to our customers. Candy-flavored tobacco products target kids and should be banned in the city of Philadelphia. This is a no-brainer. So let's get caught up to speed and make Philadelphia a first-class city. We must stop targeting our citizens, the young, black, poor, and innocent. The black race of people have suffered more than any other race of people in the history of our country. We must ask ourselves, how did we get here? Corporations, drug dealers are only interested in profits, and we have to stop this.
Thank you very much for your testimony.
Thank you.
Can we have the next panelist state your name for the record and begin?
Okay, thank you so much. Hi, good afternoon.
Good afternoon.
My name is Tanetta Graham, and I am a proud resident of Strawberry Mansion, a 90% African-American neighborhood in North Philadelphia, as well as the president of the Strawberry Mansion Community Development Corporation. As a concerned resident and community leader, it is very important for me to lend my voice to an issue that is causing generational harm to our fellow citizens. That is the predatory marketing and targeted use of flavored tobacco products on low-wealth African-American communities, especially our youth. I commend this committee for inviting the public to express our concerns about this growing tobacco issue, and I am hopeful that the information shared with you today about flavored tobacco and targeted marketing toward youth in neighborhoods like Strawberry Mansion will intensify the tobacco discussion and prompt much-needed regulations and monitoring of the tobacco industry's operation in Philadelphia. Upon reviewing Philadelphia statistics on flavored tobacco use and the correlation between the data and the characteristics of neighborhoods like Strawberry Mansion, the strategies to promote flavored tobacco use among African Americans, especially youth, are clearly evident. In fact, African American communities are under the serious influence of unfair marketing practices by tobacco industry through the following: numerous flavored tobacco retailers. Strawberry Mansion has a disproportionate amount of corner stores and delis that sell flavored tobacco products. These products are colorfully wrapped, and they have the appeal of candy, and they're often named after popular youth treats such as cotton candy, peanut butter, bubble gum, and jelly. They occupy more shelf space in stores within African American communities, and in most cases, they are on display near the real candy in order to influence youth purchases. 2, the product's discounts in the single packaging. Flavored tobacco products such as cigars and cigarillos are often discounted with a price promotion and coupons, in addition to being sold in packages with a small number. This makes the products cheaper and easier for youth to purchase. And then there's the mass advertising. Flavored tobacco products are advertised heavily in Strawberry Mansion in ads that are culturally tailored with images and messages that appeal to African American youth. These are just a few of the marketing strategies that influence our youth to begin the path of tobacco use. According to the Food and Drug Administration's March 2018 press release, each day, 2,300 youth under 18 smoke their first cigarette, and about 1,900 in a day smoke their first cigar. Current studies concur that 81% of youth ages 12 to 17 who have used tobacco products started with a flavored product. When youth tobacco users are asked why are they so attracted to these flavored products, their response is that the flavors make the tobacco less harmless and that they come in flavors that they like. Responses such as these prompted the Philadelphia Department of Public Health and the Strawberry Mansion CDC to develop the Get Healthy Philly Youth Tobacco Initiative to educate youth about the harmful effects of flavored tobacco and to facilitate a youth-led community engagement effort to learn more about youth attitude and knowledge of flavored tobacco use. In the summer of 2017, participants surveyed over 400 African American youth living in Strawberry Mansion and found the following. 97% had been exposed to any type of tobacco promotions, and 33% did not know the effects of tobacco flavoring on repeated tobacco use and quitting. The survey yielded striking results about youth tobacco use and profiling. Of the most striking, our survey found that 82% of its youth respondents were in favor of more laws to reduce the harmful effects of tobacco. That is a clear call for help. After analyzing their data, our youth survey suggested the following: passing legislation to ban flavored tobacco use, tobacco-free school zones, more enforcement and penalties for retailers who sell tobacco to youth, and an increase in the education and public awareness campaigns to counter tobacco. We are proud of the work and excited to spread their message to representatives like you so that you may hear their call to action and respond with measures that will protect them from a life struggle with tobacco addiction. Flavored tobacco use and the strategic profiling to youth in communities like Strawberry Mansion further burden our neighborhood and increase the work of combating the health, social, and economic threats that harbor in many households. Stricter regulations or a total ban on tobacco advertisement and promotion toward our youth will protect youth in Strawberry Mansion from initiating their addiction to flavored tobacco products. Likewise, dedicating more resources to intensify tobacco prevention campaigns will lower the risk of non-smokers and encourage existing smokers to explore cessation treatment. Today, you have heard compelling evidence that flavored tobacco products are attracting and addicting our younger generation. We implore you to respond boldly and enact the smart legislation that calls for a full flavored tobacco ban and supporting impactful tobacco prevention programs with adequate resources. Together, we will strengthen the African American community's resistance to tobacco and secure the health and future of our generations. Thank you for your attention.
Thank you for your testimony. I do want to acknowledge that we've been joined by Councilman Al Talkenberger and Councilwoman Blondo Reynolds Brown. And sir, if you could state your name for the record and begin your testimony.
Good afternoon. My name is Dr. Brian Jensen. I'm a practicing primary care pediatrician in West Philadelphia and a researcher at Children's Hospital of Philadelphia and the University of Pennsylvania. I'm here today in my official capacity as a doctor to offer my expert insight as someone who takes care of children, adolescents, and young adults in our city, so this group can have the best evidence available to them on this critical health issue. Children are a vulnerable population, and my job as a pediatrician is to protect them from harm and dangerous products. There is significant evidence that flavored cigars are a dangerous product. Tobacco use is a leading cause of disease and death in Philadelphia, as several of my co-panelists have already pointed out. While it's adults who face the long-term consequences of smoking, the vast majority of adult tobacco users started during childhood and adolescence. The tobacco industry capitalizes on children's love of candy, chocolates, and sweets, resulting in early addiction to their products and decades of future profits at the expense of children's future health and well-being. As you consider this proposal and all future proposals as they relate to the development, sale, and purchasing of tobacco, I hope you will consider the following information that's derived from my years of clinical and research experience, and that you will join me in my efforts to protect all of our children and future generations from the harms of tobacco. First, the tobacco industry uses flavor to attract young users. Not surprisingly, flavored tobacco products are most popular among youth. Because young people's brains are not fully developed until the age of 25, young people are particularly sensitive to the addictive effects of tobacco. This vulnerable time of development has been exploited by the tobacco industry time and again. We've even seen internal documents revealing that they added flavors precisely as a marketing tool to attract young people. Cigarettes flavored with candy and fruit encourage youth experimentation, regular use, and addiction. That's why, in recognition of this evidence, the federal government banned all flavored cigarettes, with the exception of menthol, nearly a decade ago. Unfortunately, this ban does not extend to cigars and other similar products, allowing the tobacco industry to take advantage of this loophole and legally add flavors to other tobacco products. There are over 250 flavors of cigar products alone, everything from cotton candy to strawberry margarita. While the federal ban on flavored cigarettes appears to be working and driving down the number of youth cigarette smokers, in Philadelphia, teen cigar and cigarillo, as people have commented, the little cigars, use rose by over 75% between 2011 and 2015. Cigar use is now more common than cigarette use in Philadelphia, with a similar trend across the country. The deliberate targeting of youth is addicting a new generation of users and undoing the progress of previous tobacco control policies. Second, flavored tobacco increases youth experimentation and creates lifelong smokers. Flavored cigars and cigarillos are major starter products that get kids hooked on tobacco by masking the harshness of smoke and making the smoking experience more tolerable and enjoyable. Over 80% of adolescents and young adults who have tried tobacco report that their first product was flavored. When asked why they use tobacco, young users consistently say, as my co-panelists mentioned in Strawberry Mansion, is because they like the flavors. Youth are also more likely to experiment because they wrongly think flavored products, especially cigars and cigarillos, are more natural and less harmful than cigarettes. In reality, the same toxic and cancer-causing chemicals in cigarettes are produced in cigars at even higher levels. Still, their brightly colored foil packaging, fun and engaging names, and fruity sweet smells only create this false positive image of these flavored tobacco products for kids. Flavored products may even make it harder to quit. Individuals who used a flavored product when they first started smoking are more likely to still be smoking today compared to those who used a non-flavored product. As a doctor, I see firsthand the long-term consequences of tobacco use and how devastating they can be for my patients and their loved ones. Preventing children from ever picking up their first tobacco product is by far the best thing we can do to protect them from tobacco-related disease and death. Thus, with the recent legislation introduced by City Council, we now have the opportunity to ban flavors in cigar products in Philadelphia, eliminating one of the industry's most relied on tactics to target children and giving our young people a fair chance to lead tobacco-free lives. The country's leading medical and health advocacy groups, from the American Academy of Pediatrics to the American Cancer Society, all agree that flavored tobacco products are made for the purpose of attracting kids and fueling the addiction of a new generation of lifelong users. Several major cities, including Chicago and Minneapolis, limit the sale of flavored cigars. San Francisco went one step further and banned all flavored tobacco. Philadelphia children deserve the same protections. We can no longer afford to wait as children and adolescents pay the ultimate price. We should prevent access to these products. Thank you so much for the opportunity to speak with you today.
Thank you very much. Councilman Jones?
Thank you so much for your testimony. I remember you testifying before, and the reason, in part, why we're here, along with the Health Commissioner and his staff's advocacy, is you're the reason. And when you talked about the geography, and that's what hit me hardest, as to where these products are targeted, and low-income areas, impacted areas, minority areas, to make sure that sales were high. And the point, I went to take my granddaughter to school. I get pop-up duty, I call it, every now and then, to drive her to mathematics and science school. And so my job was then also to get her lunch. And so when you go in some of these stores, there's not a healthy lunch. There's not a fruit or vegetable I can add to her diet. And what struck me worse than that fact was that these were closely product placed together. And so for my granddaughter, you know, she's an impulse buyer like me. She wanted this stuff and didn't know why. So when I asked the store owner, why is this product placement so close? And when I further looked, there were small pipes. Small pipes located right near that. And I asked why he would do that. Why would you? He said, because I legally can. Because the law doesn't protect, I interpret, I'm paraphrasing now, doesn't protect the kids from that kind of display. Well, I went to other parts of the neighborhood to get the lunch. Guess what wasn't there? These products closely placed together. And another council person who I admire talked about a way of disrespect that sometimes urban areas get, and this is a continuation of it. And I remember your testimony, and Dr. Scientifically knowing the pathways to addiction, that the flavors are designed to stimulate, you know, well-being and things like that to get us to partake. So it's not just my imagination, it's by design, and I appreciate that comment. Thank you, Madam Chair.
Thank you. Councilwoman Brown?
Good afternoon. In the work and the homework you've done in your research with other cities, what other takeaways can you share with us, if you know of any, of how the industry has cooperated in a responsible way?
I think I'll start by saying, one, just the evidence around the actual action first. So the banning flavored cigarettes has seen a dramatic decrease in the actual kind of uptick of cigarettes by children and adolescents.
Pull the mic closer if you would.
Oh, I'm sorry.
Please.
So the first point is that there is strong evidence that the banning flavored cigarettes themselves has led to a decrease in consumption of those cigarettes. That's the first thing. So that's where we're kind of extrapolating to this other space. I'll defer to kind of my colleagues at the Department of Public Health in terms of the other kind of actions by the tobacco industry in those particular places. I know there's been strong support in San Francisco, Chicago, Minneapolis, and now New York for these kind of efforts. But I'll defer to my public health colleagues if there's any other coordinated action back from tobacco companies.
Mm-hmm. Thank you. Any other comments or observations in terms of takeaways from other municipalities? Thank you. Thank you, Madam Chairwoman.
Thank you, Councilwoman. Thank you all for being here for your very important testimony today. If we can have the clerk call up the last panel. And is there anyone else here to testify on this bill?
Etheline Baylor, District Council 47, and Mark Mendenhall, American Cancer Society, Cancer Action Network.
And I do not see Ms. Baylor here. Okay. Is there anyone else here to testify? Call.
Thomas Bryant, Victor Marciano, Bhavish Patel, Fred Wilson, and Hawk Chakaiti.
And if we could just have the first three come forward that were called, and the others will call you back as soon as this panel is done. So call this gentleman, the first two after that. The first two on the list.
Yes, Thomas Bryant and Victor Marciano.
Very good. Please state your name for the record and begin your testimony.
Good afternoon. My name is Mark Mendenhall, and I'm an advocacy volunteer for the American Cancer Society Cancer Action Network. And I'm also a longtime resident of West Philadelphia. The American Cancer Society is here today to help the Philadelphia City Council members to protect kids and communities throughout the city from a very real problem: the promotion and sale of flavored tobacco products. City Council Bill number 180457 has been introduced to restrict the sale of some types of flavored tobacco products in the city, including cigarillos that are sold in small, cheap packets that often look like candy packets. I'm also a volunteer in our parks, and we do cleanups in the parks, and I find these packets all over the parks regularly. We agree that these products must be restricted, but we also, the American Cancer Society, also asks, why are we stopping at only some of these products when there are so many more out there that need to be attached to this bill and that the children need to be protected from? We are here to ask today, the American Cancer Society is here to ask today that you also include the other highly addictive flavored tobacco products, menthol cigarettes and electronic cigarettes, to this legislation. And why is this so important? Menthol lessens the harsh taste of tobacco and eases the initiation of young, inexperienced smokers. We've already heard this from other speakers. Menthol makes cigarettes easier to smoke and harder to quit. The chemical compound menthol creates a cooling effect, reduces the harshness of cigarette smoke, and suppresses coughing. These effects may make menthol cigarettes more appealing to young, inexperienced smokers, and research shows that menthol cigarettes are more likely to addict youth and are more difficult to quit than regular cigarettes. The tobacco industry continues to spend millions of dollars promoting menthol cigarettes through channels that target specific populations, including African Americans and younger consumers. Youth are also taking up electronic cigarettes, as we've heard, at an alarming and increasing rate. These products are flavored and come in many designs that are designed to attract young users. As you can see by the packaging alone, it looks like candy half the time. Kids and their parents are often unaware that these products contain nicotine, and they may become addicted. Nicotine is not safe for anyone, but it is especially harmful to the adolescent brain, which is still growing and developing. Once addicted, there is a greater risk for kids, as we've also heard, to experiment with other forms of tobacco. E-cigarette use among youth and young adults is strongly linked to the use of other tobacco products, such as regular cigarettes, cigars, hookah, and smokeless tobacco. So this is a very real problem here in Philadelphia. And although it is illegal to sell tobacco products to persons under 18, we've already heard these sales are still occurring. In fact, this was confirmed recently at a hearing in this chamber on October 27th, 2017, when young people talked about the easy access to these products. Therefore, the American Cancer Society is asking that you strengthen this important legislation by doing two things. First, we ask that you add both menthol products and e-cigarettes to the bill. Second, that you restrict the sale of all flavored tobacco products to adult-only tobacco retail stores. We have a copy of model language developed by the Tobacco Control Legal Consortium, which we can provide you as a reference. Cities like Oakland and Minneapolis and some others have already created these restrictions. In making these changes, you will help to protect all kids and restrict the sale of all flavored tobacco products here in Philadelphia. Thank you for the opportunity to testify.
Thank you for your testimony. Can we have one of you gentlemen state your name for the record to begin your testimony?
Good afternoon, council members, and thank you for the opportunity to be heard today.
Good afternoon.
My name is Victor Marciano, and I represent Station Management Consultants. We operate a convenience store in the city of Philadelphia with gas. 2007. 2007 was the last year that our company opened the store in the city of Philadelphia. That's 11 plus years. That's a pretty long time, actually. Let me share with you some Philadelphia taxes and licenses that have increased over that time that have caused a huge detriment to our business and livelihood. Hazardous materials, retail motor fuel, food license, tobacco tax, sewer stormwater charges, cigarette tax, another cigarette tax, and most recently the sugar tax. I've been made aware now within the past few weeks of this upcoming tax, or ban, my apologies. These products that we speak of today are not merchandised in our stores next to candy. Our company has spent over $250,000 in registers upgrades over the past few years in an effort to make sure employees can scan IDs to prohibit these sales to youth. We ask that you take your time in this process, in this decision, before making one that would greatly, greatly affect all of us here today and moving forward. Thank you for your time, and we appreciate it.
Thank you for your testimony. And if you want to state your name for the record, sir, and begin.
Sure, no problem. Good afternoon. My name is Bhavesh Pachal. I own a smoke shop in Torresdale Avenue in Philadelphia. Mostly we sell is like all the tobacco flavors, as a hookah flavors and everything. So if you ban flavors, we'll be out of business.
What kind of business?
Smoke shop.
Hookah?
Hookah, yes. So we sell mostly all the hookah flavors and all tobacco, chewing tobacco, snuff, and so that's it. Thank you.
Okay. Thank you very much for your testimony. Thank you, gentlemen. Any questions? Councilwoman Brown?
Yes, yes.
Oh, I'm sorry.
Good afternoon to all of you, and thank you for the diversity in the testimony, because what I know the sponsor of the bill is working through is how you strike a delicate balance in protecting our children while we hold harmless small businesses that are doing the right thing in our communities. And so, forgive me, sir, your name again that has...
Victor Marciano.
Forgive me?
Victor Marciano.
So how many employees do you currently have in your within your operations?
Inside and outside the city as a whole, about 130 to 140.
So that's potentially 130, 40 families that would be, that may be impacted by this type of legislation. Is that what I hear you saying?
I believe in the trickle effect, Councilman. So that's more than 130 and 40. I mean, that's a multiplier.
Mm-hmm. And what would you offer up to those of us on this side of the table on how we can get more small business owners to be responsible and conscientious as you are when it comes to this type of merchandise?
Just what we're doing here today. I mean, you know, meeting with the council members, making a difference in our communities, you know, not just sitting there and, you know, putting a Facebook post out that, you know, somebody's upset about something. I mean, you know, having more of these, you know, types of meetings, you know, one-on-one with the council members to come together and make sure that we're working together as a whole. I mean, you know, ideas are what stem, you know, great decisions, and, you know, so, you know, working together is always what's best, and having shared thoughts. And I apologize for repeating myself a little bit here, but, you know, I can't emphasize it enough. And it's very important to do that, to have an open dialogue and an open forum to hear both sides.
I completely agree, having been down the road a couple of times with major pieces of legislation where we ended up at 360 degrees apart and were able to find common ground as a result of the fact that we kept talking, however long it takes.
Absolutely.
Now, to you, sir, that owns the hookah store, H-O?
Smoke shop.
Smoke shop. How would this legislation potentially impact your type of business and others like you who are in this line of business?
We sell mostly like all the hookah flavors, which is tobacco. So that's basically.
I don't know that I understood your response.
We sell tobacco, all the tobacco flavors, and the hookah flavors. So if you stop the flavors, then there is nothing to there is nothing we can sell in our shop. So we have to close down.
Okay, so that's to suggest that your type of business is strictly for adults.
Yes, it's for only for adults. Yeah.
Okay.
So we only sell over 21.
I see.
We don't sell under minor. Yeah.
That's very helpful. Thank you. Thank you very much. Thank you, Madam Chairwoman.
Thank you. I was just fixated on that little boy holding up that sign. It was just too cute.
Hold it up again.
Hold it up.
Okay.
So he was holding up a little, yeah, he's so cute. Councilman Jones?
Yes, out of curiosity, I haven't purchased a pack of cigarettes in a while. How much is the retail price of a pack of cigarettes today?
Yeah, it varies, yeah.
Huh?
It varies, yeah.
Anybody?
$11.
$11?
Yeah.
So here's my point. Here's my point. So that means, I remember in the 80s when cocaine was king. And a lot of people in the inner city areas couldn't afford cocaine because it was a high-priced drug. So what they did was created a derivative called crack, okay? So that they could get both market tiers. So at $11, I can buy 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, oh, one more. Does anybody have 11 flavored tobacco products? So it's a lower market price to enter people into a marketplace that leads to cigarettes. I remember walking my dog at 59th and Upland Way, right around a middle school. 5 young men come out of the store with these. They empty the contents out, they put other products in, and looked at me and said, "Marijuana's no longer illegal. What you looking at, old head?" I don't like old head, but I took it. And there was a mismarketing to say that it's not legal, it's not criminal, and it is not encouraged by this body as an entryway, gateway to other things. So I want you to know that one of the things that I'm concerned about is the easy access price to these products. That, I don't have to save my pennies to the $11. I can just, for 99 cents a packet, have my tobacco fix. And I've got a problem with that, Madam Chair.
Yes. Thank you. You have to sign up to testify. You have to sign up. You have to sign up over here to testify if you'd like to say something. You have to sign up over here to testify, sir. You're welcome. I do want to recognize the presence of Councilman Greenlee. And since there are no additional questions from members of council, thank you very much for being here to testify today.
May I just quickly just say, Councilman?
Sure.
I mean, that's the point earlier, to state that, an open dialogue, before these types of hearings would certainly benefit, I think, both sides.
Okay.
Certainly.
That would be appreciated.
Thank you very much for being here today.
Thank you.
Can we have the clerk call up the next panel?
Harless Timmons.
If there's anyone else who would like to testify, please sign up now. Please let us know now.
Good morning.
Good morning, or good afternoon, Mr. Timmons. How are you?
It's always good to see you.
It's good to see you as well.
Absolutely.
Please formally state your name for the record and begin your testimony.
Yes, my name is Horace Kevin Timmons III, and I'm the CEO and founder of the John and Shelby Timmons Foundation. And I'm also a volunteer coach at Dobbins High School.
Please begin.
Okay. This issue is critical to our community. And I'd like to commend y'all for, for taking up the fight to have the neighborhood have a healthier environment, right? And I'm talking about from personal experiences. These stop and goes, these delis, these places that in our community attract a certain kind of element, right? They want to hang out there all day, stand around, this, that, and the third. And it's also a avenue for people who's dealing drugs, to have like a sort of safe haven. This cannot continue. This cannot continue. As a progressive society, we need to do things. Sometimes you have to protect people from themselves, see? And a lot of people do not like this, right? But that's on them. This is necessary, it's needed, and I can't stress that enough. Now, working with young people every day, right? Councilman Jones, you brought up an excellent point, and I like the demonstration, right? Because people are visual. You can talk to them, but when they see stuff, it makes a whole difference in what we're talking about. But these places do our neighborhood no good, right? It's too many of them. It's too many of them. I was out Woodland Avenue, and I was in the car with somebody, and I said, listen, watch how many delis you see between now and where we're going. We counted 18 delis. Now, how much beer do you need? How much beer can you buy? So this issue is important. I'm glad that y'all, addressing it, right? Yes. And, if anything I can do, Councilwoman Bass, you got my number.
I got your number. I know how to reach you, Mr. Timmons.
Give me a call. But
I certainly will.
I'd like to say thank you, and y'all keep up the good work.
Thank you so much for being here and for your testimony.
Absolutely.
Sir, you want to state your name for the record and begin your testimony?
Thank you. Thank you, Madam Chair.
You're welcome.
I'm Fred Wilson, and I'm the Director of Outreach for the National Sheriff's Association, and wanted to offer our perspective on the general issue of banning anything. We know in criminal justice that quite often when you ban something, that creates a desire that is often supplied by a criminal element. We see nationwide that happens on a regular basis. It turns into illicit trafficking of the item, transportation of it, and it adds to local assaults and robberies and other incidental local crime, as well as we're now seeing lately, it's providing a nexus with international terrorism. Some of this is going directly to international terrorism, as the ATF can certainly assert to. We're concerned generally also about the effect of banning something on the law enforcement prerogative. With dwindling budgets, if any of these items and the increase in crime and everything else falls to local law enforcement, where is the budget to ride herd on it? Where's the budget to make a difference? Where's the budget to have programming? And I can assure you that local law enforcement in the surrounding area does not have enough staff to go into every market of these products to assure themselves that it's on the shelves or off the shelves, or to deal with the incidental crime that's going to emerge out of it. We have a position as a national organization that we look very carefully at the effect of unfunded mandates on our constituents in the local community. So we would urge you to take a good look at the effect of this on that kind of a situation.
Okay. Thank you very much for your testimony. And can we have the last group? Do you have a list? Okay.
Zachariah Aslam, Jonathan Kohler, Keith Chenault, and Bilal Bakwar.
Okay, and if you four could come forward. And please begin your testimony. State your name for the record and begin your testimony.
My name is...
I'm sorry, please state your name for the record and begin your testimony.
My name is Bilal Barkawi. I represent the 7-Eleven Luke Oil. I'm the Vice President of the Delaware Valley Philadelphia Owner Association. Actually, I was not planning to testify or to talk about this topic. I want to respond to Mr. Councilman of what he stated over here. You have to understand, guys, we are with you, and we are with them. But can you tell me what is the distance between City of Philadelphia and any Bucks County city? What is the distance? If you stop all of these flavors, can you prove to me that in City of Philadelphia nobody sells cocaine? Nobody sells the tobacco flavor? They do. Bucks County, they're gonna have the business. You're hurting my business. We are not selling, we did everything that you needed. 7-Eleven and Luke Oil, which I represent, and I used to be a Sunoco also. If you go to check the registers, they will never sell anything to minors. If you see anything in front of the counter, come and punish us. Come penalize us. If we sell to minors, come and close my store. But you are now taking a decision that you want to ban the flavored tobacco. Can you guarantee to me that tomorrow or a month after you ban it, it will not be selling in the market? You know what you'll be doing? You are hurting the legalized businesses that represent City of Philadelphia to the street. They're gonna go to Bucks County, to my store in Luke Oil. I have businesses in Bucks County. They're gonna buy the quantities and they're gonna sell it illegal in the market. What you're gonna lose? Employees tax, sales tax, business privilege tax, and lost the business. That's what you're doing, sir. We are with you. If you come with the legislation right now that's gonna ban all state of Pennsylvania, I will stand up and I will help you. And you're closing our businesses. That's what you're doing. Fine, you're stopping the flavored tobacco. I agree with you. 1, 2, 3, 4, all what you did right now. Did it stop? You put the $20 on the cigarettes. Did you achieve your goal? We're still selling cigarettes, and they go, guess what? My business at Bucks County went up about 30–40%.
So I'm going to have to ask you to summarize, if you don't mind. If you want to sum it up.
Sure.
Yeah.
Sir, we are with you, but don't hurt me.
I'm not going to respond. I'll wait until.
Okay.
Thank you.
Thank you for your testimony.
Sure.
The next panelist want to start. State your name for the record and begin your testimony.
I'm Jonathan Kohler. I am an addiction advocate and addiction professional. I have a background in behavioral health, public health, criminal justice, and social work. I'm here to remark upon Councilman Jones's comments about what is being used in these products that are being sold. What we see is that with these products, they're used in the commission of substance use. These substances used are marijuana and synthetic cannabinoids, such as spice and K2. What has recently been released by the CDC is a statement that life-threatening coagulopathy is now associated with synthetic cannabinoid use. In accordance with the aforementioned remarks, a prohibition of these products is a public health action that ensures public safety. Working in the field of addiction, I've conducted surveys within my facility in order to gauge tobacco use among our participants and recipients of service. And what we found at a 39% participation rate was 90% of those who participated used menthol tobacco products. Philadelphia is in the midst of an opioid epidemic that everyone is aware of. Taking stances to add menthol to this legislation and taking stance to restrict these products only ensures to help protect the health of this very vulnerable population that is oftentimes neglected. Thank you.
Thank you very much for your testimony. Sir, if you want to state your name for the record and begin.
Yes, my name is Zakaria Aslam. I was just, Brother Bilal pretty much said everything I wanted to say is, again, a lot of these products aren't being used to actually smoke, like Councilman Jones was saying. It's used for other products. I use a lot of those products, and I use a lot of the other product that is used in as well. I'm not gonna lie. So I'm being honest, and it's becoming illegal, and pretty much it's become recreational. I mean, I don't know why we're going to ban something that's going to bring business into the city of Philadelphia, because pretty soon, I don't know what else you guys are going to start taxing. Like, I bought a business, I bought a Sunoco. Now, to buy that Sunoco, my mother got a loan on her house, on her houses. So, after you guys added that tobacco tax, the value of the business fell, and now the person coming in can't buy a cigarette, get a cigarette license. So now the value of the business fell even more. So now I can't even sell the business and pay off the loans. Or, matter of fact, I could barely even keep up with the payments of the loans. So she was on the verge of losing her house, and then the city increased her property taxes. So now, not only were we going to lose the house to the loans, we were going to lose the house to the city because of the sheriff's sale. We were keeping up the taxes. This is all on record. This could be checked out. So all I'm asking is, I think you were saying is, what are the businesses willing to give up? I mean, we're already giving up the product, so there's not money. We can't give up, can't pay you guys anymore because you guys are raising taxes. We're already giving you more money. So I don't know what else the city would like the businesses to do besides giving up more products and more revenue. Because I don't know if you guys are noticing, Wawa's killing all the big businesses, I mean small businesses, because they're taking over everywhere. And not only is there competition within ourselves, but we have legislation that's restricting products that we can sell, and like the soda tax is being, you know, it's taking away business, and they're people are just going, like he said, people are just going across the border, Upper Darby, Bucks County, buying more, you know, and bringing it back in the city and just selling it. So I think the city is just losing more revenue by adding more taxes and more restrictions onto all these products we already use. That's pretty much it.
Okay. Thank you for your comments. Thank you for your comments. Anyone? No? Okay. Sir? Please state your name for the record and begin.
My name is Keith Chenault, and I listened to the testimony here, and I serve, or I have two sides of the story. I am an entrepreneur in Philadelphia. I own a real estate office, but I'm also a parent. So while I understand businesses need to make money because I'm an entrepreneur myself, I'm also a parent, and I recognize the dangers of tobacco use in the stores. So while we're talking about dollars, the question really has to be, well, what's more important, dollars versus my kids? Right. And I'm going to pick my kids every time. I also heard testimony about not selling to underage people for cigarettes. My office is next to 2 retail outlets. One of them has that orange sticker on the window that says not to sell loose cigarettes and not to sell to people that look under the age of 26. And I can tell you, particularly in the summer, on a given day, they sell to people under 21. And when I question, they go, oh, they look old enough. They look, well, if they look young and you can't tell, maybe you should start carding like it requires. So again, I go back to there's a practice, there's laws, and if the laws are supposed to be to protect people, and in this case, the laws are to protect kids. And any business, even mine, is as things change, as society changes, in order for you to stay profitable, you have to change with those changes. And I think this will be a good one. Thank you.
Thank you for your testimony. And if there is no one else to testify on this bill, okay, and no more comments from the committee members. This concludes the public hearing on Bill number 180457. We will now go into a public meeting to consider the action to be taken on the bill.
So we can further dive.
Okay. The chair recognizes Councilman Jones for a motion on Bill number 180457.
Thank you, Madam Chair. I move Bill number 180457 out of committee with a favorable recommendation, and further move that the rules of council be suspended to allow this bill to be read. Well, yeah, wait a minute. To be read at next session. but we will hold it until September so that we can further dialogue with stakeholders.
Second.
Okay, it has been moved and properly seconded that the amendment, it is moved and seconded that the bill be reported out of committee with a rule suspension and a favorable recommendation. All in favor will signify by saying aye.
Aye.
Those opposed? Okay, the ayes have it and the motion carries, and bill number 180457 will be reported from this committee with a favorable recommendation with the request that the rules of council be suspended to permit first reading at the next session of council. And this could...
Okay. So I would like to be recognized.
Whoops. Okay, so we're going to start over. I'm sorry, we do have an amendment to this bill. So the chair recognizes Councilman Jones for an amendment, for a motion to amend bill number 180457.
Hi, I moved, thank you, Madam Chair. I move that the amendment to bill number 180457 be moved from this committee. It has been circulated to all members.
Second.
Okay, it's been moved and seconded. All those in favor will signify by saying aye.
Aye.
Any opposed? Okay, and now the chair recognizes Councilman Jones for a motion on bill number 180457 as amended.
I move that bill number 180457 as amended be moved from this committee with a favorable recommendation, and that the rules of council be suspended to allow first reading at our next session of council.
Second.
Okay, it's been moved and properly seconded that bill number 180457 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor will motion by signifying by saying aye.
Aye.
Any opposed? Okay, the ayes have it and the motion carries, and bill number 180457 as amended will be reported from this committee with a favorable recommendation with a request that the rules of council be suspended to permit first reading at the next session of council. This concludes the public meeting of the Committee on Public Health and Human Services, and there being no further business before the committee, I thank you all very much for your attendance. Thank you.